So we have here Dr. Jain. Dr. Jain is a cosmetic surgeon. Here we go. If anyone is here, please.
Live video ended.
Okay, no, I have a live video going on here. If anyone's here, they are informing the people. Okay, there's somebody's watching you. Okay, Dr. Jain is here. He's a cosmetic surgeon from Aesthetic and Cosmetic Surgeons. And then today Dr. Jain is answering the questions. So you have any question, you can go ahead and ask Dr. Jain. Okay, yeah. Okay, I don't see any questions now yet. I see some people are joining. How are you doing today? Sunday.
Can I speak?
Yeah.
Okay. Hi all of you. It's a great sunny Sunday. It's not hot so much in Southern California. I'm here to answer your questions. I'm also going to be talking about what we are doing at Aesthetic and Cosmetic Surgeons. Our most popular procedure is, of course, liposuction, fat transfer, and body contouring. We do liposuction from abdomen, from flank, 360-degree liposuction from bra belt and the back. We are also doing we are taking out fat from inner thighs, from chin, and we can transfer fat to for gluteal augmentation, most commonly known as BBL. We can transfer fat to arms for men, to the chest. We can also transfer fat to your face, especially if somebody is looking for more natural product instead of fillers. Even though the fillers that we use are very advanced and latest FDA approved RHA fillers. A few words about body contouring. The best results that you will ever get is as long as you are very close to your ideal body weight. However, we recommend, if you are overweight, we recommend some weight loss before you can get some great results. Do you have any questions coming in?
Okay, I see some people are joining here.
Hi, people who are joining. Again, this is Dr. Jain from Aesthetic and Cosmetic Surgeons. We are located in Woodland Hills. You can call us directly at 818-220-3393. We do liposuction, fat transfer, body contouring, various other procedures including PDO thread lift. We combine it with the long-acting Daxify, RHA fillers. We also do jawline contouring for men and women. We do a lot of body contouring procedures at our place. My philosophy is not to overdo. We do very natural results. We like to have natural results. We go slow with our patients. We show them what we are doing, and then proceed. We take our time and patience with every patient of ours. I'm happy to answer any of your questions.
Would you like to talk about PDO thread lift? I think people are really interested.
Well, PDO thread lift is a great procedure. It is very good for somebody who are in the best age range. Ideally between 37 and 63 is an ideal range. Again, depending if you're in an advanced age, how much sagging do you have on your face. But we can do PDO thread lift for neck as well as for other body areas. We also do skin tightening procedures after body contouring with mesotherapy. We are doing lipodissolve. We are doing Kybella for chin and for other abdominal areas. Again, we are very affordable. Our prices are very fair. We don't believe in and making these prices go skyrocketing. We wanted to reach masses. Again, we are located in Woodland Hills. You can reach us at 818-220-3393 or go to our website aestheticandcosmeticsurgeons.com.
Can we ask a question? Are you able, guys, to hear Dr. Jain? Can we have some sign if the voice is coming through? Just a technical checkup. Can somebody reply if you guys can hear us well? Okay, this seems like the sound is coming, Dr. Jane. Okay.
Okay, I see a question is coming as to what's the price for double chin. Well, double chin we can do two ways. We can either do liposuction under the chin, or we can do Kybella. Again, Kybella has a limited life. You will have the results for about a year and a half, approximate average. And it is done with the micro needles under your chin. The other is liposuction, which is more longer lasting. For you, the pricings are different, and for an exact code, you would need to come in and consult with me so we can see how much work is involved. There is any other question on the screen?
Hello everyone who doesn't know, who just joined. This is Dr. Jain, and he's a cosmetic surgeon and aesthetic and cosmetic surgeons, and he's answering questions today. So if you please have a question, go ahead, type your question, and Dr. Jain will answer your question. Okay, we have a question, Dr. Jain. Do you do procedure for men?
I actually do a lot of procedures for men. 50 to 60% of my clientele are men, and we do pedio thread lift. We do combine it with long-acting Daxify, which is a long-acting Botox, which works for 6 months. We combine pedio thread lift for face for men with fillers if needed. We also do jawline chin contouring for men. Those are the most common procedures we do, but we can also do lipodissolve for men. We can do skin tightening for men. We can do other body contouring. We can do non-surgical rhinoplasty as well. So all those things we do for men.
Okay, all right, that was amazing. Do we have more questions to Dr. Jain? For Dr. Jain? One more question is coming, Dr. Jain. How do you do a jawline chin contouring?
The jawline chin contouring again is done two ways. We use Radius in our practice, which is a MERS product. It's an FDA approved product. We do jawline chin contouring with Radius. The other jawline chin contouring procedure that we do is liposuction under the chin, and then enhance it with a touch up of Radius if needed. Sometimes we need to do long-acting Daxify on the masseter muscle. That gives a more chiseled look. So it depends on how much you are looking to work on your jawline chin. We have a lot of procedures, and how much you want us to be invasive or semi-invasive or non-invasive. So there are a lot of options for that.
Okay, all right. So I think one of the most anticipated and most highly requested procedures is about, again, liposuction and the fat transfer. Okay, there's a question coming. Is liposuction of the chin painful?
There is definitely some pain and discomfort after the procedure, especially in the first 72 hours. You may see some slight bruising and swelling in the first 3 days, but I put all my patients on some prophylactic antibiotic. I give them pain medications for the immediate 3 to 5 days. Usually you are able to go back to work after the third day. You have to wear a chin wrap. I would recommend you wearing a chin wrap for a week, and then at least for next 3 weeks or 2 weeks just for the night. You can take out the chin wrap during shower, or maybe you're going out for dinner, but mostly I would like you to wear a chin wrap. That's the most part of it usually.
Okay, there's a question coming. Do you treat plastic surgery complication as well?
All the time. That's what I've been doing. Mostly I treat a lot of plastic surgery complications, people who have lost their skin after plastic surgery, say after tummy tuck, or there's a wound, or depending on what complication you have. Some complications are fixable over a period of time. Some may require more assessment. So it's a case by case basis. It depends what you have.
Okay, and one more question: where you can transfer fat to?
We can transfer fat. We can transfer fat to face. We can transfer fat for your gluteal augmentation. That's BBL. We can transfer fat to your arms if you're a man. You're looking for more masculine look, depending where you're looking for. Where we take fat from is abdomen, flanks, the back bra bulge. Many women complain about that. Inner thighs, pubic area. We can take fat from under the chin. Those are the most common places we take fat from.
Okay, and it can be transferred anywhere in the face, facial area as well?
Yes, depending on what your needs are, and we will have to assess where we can put the fat to, and we will make a plan. We will first do a consultation with you and then decide where we are moving this fat first.
Okay, and is it the difference between the fillers and then the fat that which we transfer in the face?
Well, fat, it's your own fat, so the chances of it staying longer way more. Fillers have a different length in each case, even though the package may say 9 months or 12 months or 12 to 15 months, but each patient reacts differently to filler in terms of the duration that it remains in the body or shows its effect. The longest acting fillers that we use are the RHA fillers, and the packaging says 15 months. We have seen it working for at least 12 months, but again, if somebody has an autoimmune disease, that may not last that longer.
Okay, there's one more question coming. Who does the consultation in your office, and is it free?
I do my all consultations. You will only meet with me. You don't do any consultation with any nurse in my office. You will directly meet with me and I will do the procedures. I don't use any nurse or nurse practitioner for doing aesthetic and cosmetic procedures.
And they're asking if it is free.
My consultations are free, yes.
Mm-hmm. Okay, there's a question coming, Dr. Jain. I see a question about facelift. Can you please answer? She's curious about how long does the effect facelift lasts.
If you're talking about non-surgical facelift, my non-surgical facelift I usually do with PedioThread facelift. I combine with long-acting Daxify, which is long-acting Botox, which works for 6 months, and RHA fillers. I combine it with them, and usually our non-surgical facelifts with PedioThread lift and Daxify RHA fillers will last you about at least a year and a half, depending on your lifestyle and your age when you do these procedures. If you are just getting into these procedures and you are around 60, you should have realistic expectations about these. If you are slightly on a younger side, in your 40s, you will get some very good results as long as you are maintaining, you're doing other things that we can talk about during the consultation.
Okay, and then can let's say the patient do a filler, how soon after, let's say, PedioThread lift, or let's say if they've done filler before, when they can do a PedioThread lift?
It all depends. It all depends where we are doing the PedioThread lift, the areas that we are lifting or that we are rejuvenating. Sometimes we can do it all together. Sometimes we will have to call you back in 3 weeks and do it. It all depends what areas in your face are we targeting. Sometimes there is really no conflict, and we are targeting different areas. We can do it at the same time, everything. It all depends.
Okay. One more question. Can the pedio facelift be repeated, let's say, after how many years or so?
If we recommend you doing these procedures year to year and a half, it all depends on your age and where you are in your aging process. You can, usually the pedio threads that we place or anybody places, they all dissolve in 6 months, but they make type 1 and type 3 collagen that gives you glow and that gives you the lift. So the touch-up or repeat procedures are recommended a year to year and a half, and again depending on your age, where you are, depending on your aging process.
Okay, there's a question. Do you work with FDA products?
Only FDA approved products are used in my practice. We do not use anything that is not FDA approved in the United States.
Okay, one more question. What is RHA? Somebody wrote factor, maybe they meant filler. And do you do that? What is RHA?
RHA is the most advanced filler. It is marketed by a company called Revance in the United States. It comes in, it has 4 different types, the Redensity, RHA 2, 3, and 4. You can go to Revance website and read about RHA fillers. They are the most advanced and have the best molecular complexity network built in. I love those products. I get very good results with those products, and that's what I've been using.
Okay, and then there's also a question. Do you have a credit program or financing?
We work with Care Credit. You can go to my website, aestheticandcosmeticsurgeons.com, and go to pay online option. There you will see Care Credit a link. You can click on that link. You can pay through that, or you can apply for your own Care Credit. They give you a response within minutes, I believe. And yes, we will accept Care Credit. There is no interest up to 6 months in our practice.
Okay, that is actually very good. That's very good. All right. Do you guys have any more questions? Okay, can we choose from different types of Botox? Like choose whether we want Revance or something else? Like they asking about different types of Botox, Dr. Jain.
Well, there are basically 2 types of Botox: short-acting Botox and long-acting. The short-acting ones are the Botox and the Xeomin. That you know of. The long-acting ones are the Daxxify. The Daxxify may work up to 6 months. It is the longest acting Botox, and you only have to do 2 times in a year. It has a peptide in it, which also gives a glow to your skin. I love the product. It's a very good product. It takes some time to work. So the short-acting Botox, it works about 3 months, and it starts acting within 3 days. The long-acting Daxxify works for 6 months, but it takes about 6 to 7 days to kick in.
Okay. Question: what type of filler is used for the lip filler, and how do we dissolve the lip filler?
Well, any hyaluronic acid based fillers can be dissolved with Hylenex, basically. And we do lip dissolve of these fillers all the time, so they can be dissolved as long as they are HA based, hyaluronic acid based fillers.
Okay, hyaluronic acid based fillers. Does the Botox treatment require a regular follow-up?
Short-acting Botox you will need to do every 3 months if you want to keep up and not have those dynamic wrinkles. And for the long-acting Daxxify, you just need to do 2 times in a year. It works for 6 months.
Okay, one more question. Is PDO thread lift painful, and how does it work?
There's a slight discomfort. The PDO threads are placed under your skin. When we see you and when we know what areas we are targeting, which folds, which wrinkle, which sagging area, we will first draw on your face. We will with a drawing pen or a pencil. I work with a sculptist, artist, micropigmentologist who will first draw on the areas that we are targeting. Then these threads are placed under your skin. Either I will lift it, or I will use threads to make more collagen, for example, for rejuvenation or volume, depending what we are trying to achieve. All this we will first discuss with you during as we are going on the day of the procedure, or even before, if you like. But it's and you asked about whether it is painful. There is some discomfort. We do numb you first, and we also do some lidocaine injection. So it's a very slight discomfort, but you can have some discomfort. We try to make it as smooth and painless as possible.
Okay, that's great. Actually, no one has complained so much yet. People actually very comfortable in the procedure. Okay, there is a question. Do you do non-surgical rhinoplasty?
We do non-surgical rhinoplasty, yes, as well. We do some nose work. Um, yeah, you just have to come in first for a consultation so we can figure out what you need.
Oh, okay, okay. Is it done with fillers or how is
Yes,
it
we
done?
do non-surgical rhinoplasty with filler, and we use hyaluronic acid base fillers that are dissolvable as well.
Okay, how long does effect last?
Again, it's individual, case by case, anywhere from a year to year and a half, anywhere between that time. That's how long it will last.
Okay, that's interesting. Okay, somebody's asking, do nurses botch the people for fillers?
What's your question?
Somebody's asking if do nurses botch people for fillers?
Do nurses botch? It it doesn't matter whether they're nurses or doctors. Anybody can botch who doesn't know what they are doing. I mean, there is no way. I mean, there are some very good nurses, I believe, who do the work very nice, and there are some very bad doctors as well. So there's no generalized statement to that.
All right, it's all probably about anatomy knowledge. All right, and do you have any more questions? Okay, I see some people here. How are you doing today? We have Dr. Jain. He's a cosmetic surgeon from Aesthetic and Cosmetic Surgeons.
We are located in Woodland Hills of California. Our contact number is 818-220-3393. Call us, and you can also talk to me directly. You can also reach our website at aestheticandcosmeticsurgeons.com. Look at our Instagram page. We are posting as many as possible, our before and after, so you can see our results, what we are doing at Aesthetic and Cosmetic Surgeons. We are very excited to have you with us today. Thanks for asking all these questions.
We have some more questions, Dr. Jain. I'm sorry. Somebody's asking, I had got some filler done from the nurse, but I feel it's displaced. Can you help me with that?
Where was the filler done? I need some information. Where did it got displaced? It's best to call us and set up an appointment. Our consultation is free. We can then talk what we can do for you.
Maybe the person is asking what are the options, how to fix it. Let's say if it's displaced, like
we need to know first what kind of filler were used, and where it was done. Where do you see the displacement? What symptoms you are having, or what signs of displacement you are having, and how can we target it? So we need to see you for that assessment. You can call us and make an appointment. I can give you an earliest appointment that's available in my diary.
Okay. One more question. What procedure can you do to sculpt the cheekbone?
The cheekbones are usually done with a higher G prime filler. So if you are looking only to enhance your cheekbone, we can do it with an RHA4 product. We can also do it with a radius if you're only asking to enhance your cheekbone. That's what we use.
Somebody's asking, are you located in Woodland Hills?
We are located in Woodland Hills. We are off on Topanga Canyon Boulevard, so feel free to make an appointment and come into our office. Our contact number is 818-220-3393, or give us a direct message on Instagram.
Okay, that was good. Okay, well, guys, we have a few minutes more. Do you have more questions to Dr. Jain? Where can we ask questions about permanent tattoo?
Permanent makeup, you can send us a direct message on Instagram. We will respond to you promptly. We do permanent eyebrows, we do lip blush, we also do scar camouflaging, scar removal or softening it up. So we also do 3D areola tattoo for women, unfortunately, who have lost their areola due to breast surgery, breast cancer, or any other procedure done to them. So it's a very clean, very nice procedure of 3D areola tattoo that if any of your friends, family, co-workers, or neighbors are suffering from 3D areola tattoo.
Somebody's asking, how do we do a scar removal, Dr. Jain?
We do scar camouflaging. That means softening them up. Our micropigmentologist works on that for that. She's the one who is licensed for this kind of procedure. It is done with some special vitamins and special oils, and that's what we use.
Okay, all right. So I don't see any more questions coming. Guys, we have a few more minutes. Do you have any more questions? Please go ahead, ask. We have some time. Dr. Jain is here. All right.
Again, people who have just joined us, we are located in Woodland Hills, 818-220-3393. Send us a direct message through our website, aestheticandcosmeticsurgeons.com, or go to our Instagram page, send us a message there. We will respond to you very promptly.
Dr. Jain, I feel like we have not, you didn't talk much about procedure for men. Maybe men would like to know what you can do to enhance their beauty.
So for most men, again, we do facelifts, non-surgical facelift, perio thread lift. We combine it with long-acting Daxify. We do RHA fillers with our perio thread lift. We do chin and jawline contouring. We can do liposuction. We can do lipodissolve. We can do Kybella for the chin. We do mesotherapy procedures. So everything we do for men, including BBL for our LGBTQ community, we will do BBL for them as well, depending on how much they need. We are very LGBTQ friendly office. We welcome them. We've had many clients, so you're most welcome.
All right. Somebody's asking, can you do online consultation as well?
We can do online consultation if you're pressed on time. Sure, we can do. We can see you whatever you need to do. Let's say you're looking to do a hip dip with radius, or we are looking for a hip lift or a heart shaped butt with radius. We can do all that on a video consult, and it's free of cost.
All right. And then there's a question, can you do a brow lift?
We can do brow lift. I do brow lift two ways. I can do brow lift with chemical, that is Botox, Daxify related, or I can do with perio thread, or I can combine both, depending on how much you need, how exaggerated you need, and what will look also good on you. So, our opinion and your need, we combine both.
Okay. That's great. Okay, let's see. I don't see any more questions coming. Any more questions? Anyone has anything to ask Dr. Jain?
Yeah, go ahead. I ask any question. We have about 2 more minutes before we go offline. So again, we are located in Woodland Hills. Send us a message on Instagram, direct message.
Okay, there's a question. Is there anything to help with dark circles and hollowness under the eye area?
So you're talking about tear troughs. For that, I have to assess you whether you need tear trough filling. For dark circles around the eyes, use a sunscreen. Wear shades. That's most important first to prevent them. And then I would not recommend any laser work under the eyes. Please don't do that. Filling with a filler, it depends. It's not in every case. We have to assess you, figure it out, whether you are a candidate for that, and whether it will improve the dark circles or not.
Okay, that was very good answer. Okay, more questions? We have 1 more minute. There's some people. Hello, everyone.
Again, our website is aestheticandcosmeticsurgeons.com. We're located in Woodland Hills. You can contact us on Instagram. You send a message through our website. There's a form at the bottom of the page. 818-220-3393 is our contact number.
Do you have any tips on the upkeep of filler?
For maintenance of fillers, you just have to retouch your filler areas. I would recommend, depending on what fillers you are using, we use RHA fillers. We recommend touch up every 12 to 15 months or earlier, depending on how you're metabolizing. Remember that hyaluronic acid fillers are metabolized by your body, so you will see them fading away in about some time between. RHA fillers usually work 12 to 15 months. When you start seeing them fading away, go again and get a touch-up. If you're going back to the same person, I believe they will also give you some discount promo since you are their established patient, and that's what we do for our clients.
Okay, can you help with the old acne scars too?
So for the old acne scars, we can do some perio threads. That's pretty much what I do. I've had some patients who had acne scars, or they had some acne scars exaggeration after the jawline chin contouring. So perio thread lift, not perio thread lift, but perio mono threads are used for collagen buildup and revitalization, volumization.
Okay, are they inserted into the
So,
scar area?
yes, they are inserted into the scar area. They're almost painless procedure. Call us at 818-220-3393. Make a appointment. Consultations are free of cost. We'll give you prompt appointments. We also work on Saturdays, guys. Do you remember? We work 10 to 2 on Saturdays, 10 a.m. to 2 p.m. So call us, make an appointment. So I would say it was very nice talking to you all, answering all your questions. I would conclude this session and do visit our website at aestheticandcosmeticsurgeons.com. Read about us, read what we do, what procedures we perform. Look at our Instagram profile for before and after pictures and the promos that are going on. Give us a call as 818-220-3393. We are available Monday to Saturday.